Good afternoon, everyone. My name is Stephanie Lancaster, and I serve as the chair of the NACDD Member Services Committee on behalf of the National Association on Councils for Developmental Disabilities. Welcome and thank you for joining us. I am joined today by Jill Jacobs, NACDD's Executive Director, Jennifer Bertrand, Chair of NACDD's Public Policy Committee, Aaron Prangley, NACDD's Policy Director, and our special guests, Eileen Stein and Chris Cox from Center for Budget and Policy Priorities. Today's webinar is designed to strengthen our shared understanding of how the federal budget process works, and most importantly, what it means for developmental disabilities councils, state agencies, and self-advocates across the country. In the current fiscal and political environment, federal funding conversations can feel fast-moving and opaque. Our goal today is to provide some clarity. We want participants to leave with a practical understanding of what the federal spending authority is, appropriations, reconciliation, continuing resolutions, and shutdowns, and how these processes affect our work year-round. I'm now pleased to turn it over to NACDD's Executive Director, Jill Jacobs, to further frame why this conversation is so timely. Jill?
You're on mute, Jill.
Thank you, Stephanie. First, welcome everyone, and thank you for being here. I would like to acknowledge both NACDD's Member Services Committee and NACDD's Policy Committee for their hard work on this project. Thank you. I know that you all are very committed to this work, and we appreciate your efforts. So, for Developmental Disabilities Councils, federal funding is not abstract, it is foundational. The decisions made in Washington directly affect state planning, advocacy capacity, and the services and supports available to people with developmental disabilities. Understanding the federal budget process is not just helpful, it is essential to effective advocacy. We're especially grateful to the Center on Budget and Policy Priorities for joining us today. We appreciate your partnership in this. Your expertise in federal fiscal policy will help ground our discussion in both structure and current realities. Thank you very much for being here. With that, it's my pleasure to turn the program over to our presenters from CBPP.
Great. Thank you so much, Jill, and very happy to be with all of you today. My name is Chris Cox. I'm the Director of Federal Tax Policy at the Center on Budget and Policy Priorities. And let me get my slides up. Great. Everyone can see slides. Okay. Thank you for the confirmation. So as Jill said, today I'll be talking with you about the federal budget process, kind of how it works, what the different steps are, and at the end I'll talk a little bit about where we are today. There will be a bunch of technical terms. I'll try to explain them throughout. You'll hear them repeatedly, so I hope at the end you'll come away with a much more thorough understanding of how these things intersect, how they interact with the process, and what you might be hearing in the news about the federal budget process as well. So first, just to start out, I want to talk a little bit about the role of Congress and the role of the executive branch or the administration. So remember that the Constitution gives Congress what we call the power of the purse. And what that means is that Congress has the authority to set funding levels for specific programs. It does that through writing specific spending laws that say either this program should receive this number of dollars, or these are the eligibility criteria for a program, and anybody who meets those eligibility criteria can receive benefits, which results also in a way of determining how much money should be allocated to that program. So Congress holds that authority to decide on funding levels for programs. Then if we turn to the executive branch has some say on how these programs are implemented. through a variety of agencies, including the Social Security Administration, the Department of Health and Human Services, the Department of Housing and Urban Development, and other agencies. And there's also the Office of Management and Budget, which plays a key coordinating and oversight role for the executive branch. And in particular, the Office of Management and Budget sets up the president's budget, which we'll talk about a little bit more, and provides some oversight of agency performance. So these are the kind of different spheres of jurisdiction for Congress and for the executive branch. What we're seeing today is that the current administration is testing the limits of exactly what the executive jurisdiction is with regards to funding levels. So you may have heard in the news the administration withholding or delaying certain funding. That's right at this intersection of what we're talking about with regards to Congress's jurisdiction and the executive branch's jurisdiction. So when we focus on Congress and what they can do to actually write spending laws that determine program funding, one of those approaches is through authorization bills. So, for example, if Congress wants to establish a new program, it can write an authorization law or bill that sets out program guidelines. Maybe it sets eligibility. For example, Social Security has certain eligibility. If you meet this criteria, if you're this age, then you're eligible to receive certain benefits. So that is what might be contained in an authorization bill. If the funding for a program is provided through an authorization bill, because that bill sets eligibility criteria and anybody who's eligible can receive those benefits, then it's typically called what we say is a quote mandatory program. If funding for a program that's established in an authorization bill, but the funding is provided through the annual appropriations process, then it's what's typically called a discretionary program. And I promise we'll talk more about each of these terms as we go through this presentation. So if these are new terms to you, we'll continue to talk through them. If we look at those discretionary programs, funding for those programs are set through what we call an annual appropriations process. That is typically what people think of when they think of the federal budget process that happens on a yearly basis. And those appropriations bills or spending laws provide funding levels for discretionary programs. So again, those laws can say in them very specifically, this program receives X amount of dollars. This program receives X amount of dollars. These are actually laws that Congress writes and that get signed by the president in order to be enacted. There is an appropriations committee within Congress that drafts these laws, that writes these laws, and they mostly provide funding for the upcoming fiscal year, or mostly one-year funding. There's some multi-year or advanced funding. For example, advanced funding is frequently used in the education space because the school year doesn't line up exactly with Congress's fiscal year. So advanced funding helps smooth that out. But you can think of this as mostly one-year funding for the upcoming year. So this is sort of just some basic terminology. Now I'm going to put it into kind of the overall federal budget process. So in theory, this is how the federal budget process works. Going from left to right on these slides, you can see left to right follows the calendar year. And I'm going to talk about each of these boxes one by one, as well as that bright green box of reconciliation. So what kicks off the federal budget process is the president's budget. You may have heard me say that the Office of Management and Budget puts together the president's budget. And again, it's very detailed. It can go program by program and say this program should receive this amount of money. This program's eligibility should change. It's very detailed. And it's typically a 10-year plan. So I said Congress only gives 1 year of funding, but this is a plan. It's not a law. This is what the president puts together and the Office of Management and Budget puts together to say, these are my priorities. This is how I, the president, think Congress should write spending laws for the coming year. And also, this is my vision for the next 10 years, the 9 years after that. So key to remember here, it's not a law, but it kicks off the process. So if the president's budget gets delayed, which sometimes it does, it means everything else in the process happens a little bit later in the calendar year. That's part of the difference between how it works in theory and what we actually see happen in reality. So you remember that Congress has the power of the purse. Once the president's budget plan is out, then Congress has to make a plan because they're the ones who write the actual bills. They're the ones who get to decide. But before they do that, they make a plan, also often a 10-year plan that says this is what we think will happen. They determine their top line number. This is how much we should spend in total before they go all the way down to all of the individual programs. And their plan, like the president's budget, is not a law. It sets out what Congress plans to do when they actually get down to writing spending laws. Sometimes, and this was that green box, if you recall seeing a funny green box in a slide a couple times ago, it can also create what's called a quote reconciliation process, which is a specific budget procedure that can get around certain rules of the number of votes required in the Senate and also has certain restrictions, but can move more quickly. I'll talk about that shortly. Once Congress has its plan, then it focuses on writing the laws that we talked about. So spending laws get written for discretionary programs, and the Appropriations Committee has 12 subcommittees that pertain to roughly different agencies within the executive branch. So there are really 12 appropriations bills according to these subcommittee topics. They can be enacted on an individual basis or they can be packaged together. But this is where the rubber meets the road. This is where Congress sits down and spending bills require there to be a bipartisan vote. So there has to be this negotiation back and forth across the parties to say, okay, well, you want to fund this program more, we want to do this. They have to come to agreement. And so this is where they really have to sort of get to the fine details and negotiate and come in order to find agreement. The fiscal year runs through September 30th, October 1st to September 30th. So right now they're planning or they're going to start thinking about the fiscal year that starts this October 1st. And any funding that they need for that year has to be enacted by September 30th. Because starting October 1st, those programs need to have that additional funding in order to keep running. And we'll talk a little bit later about what happens if they don't come to agreement. The green box that you saw before, reconciliation, is sort of a parallel process. It's not specific to discretionary programs, which we talked about in the appropriations, but the reconciliation is often used to change mandatory spending. And again, that can be Social Security, Medicare, Medicaid, some big examples. Reconciliation can also change tax revenues. So what tax levels should be, who should pay taxes, how much. And it's not part of what people typically think of as the federal budget process. But as Congress has become more partisan, it's more frequently used because it allows the Senate, allows a bill to pass the Senate with only a majority vote instead of the 60 votes that might otherwise be required. So that's why it can be a very powerful tool in a partisan environment to enact something with a majority in the Senate. It's powerful. It also has unique rules. It has to do things that affect the budget and it can't do certain things such as increase the deficit outside of the budget window. So there are certain rules that it helps Congress get around, and there are certain rules that it adds to the process. But because it can be such a useful tool in a partisan environment, it's been used for a lot of major legislation. The bill that was enacted last year was enacted through the reconciliation process. In 2022, the Inflation Reduction Act was enacted through the reconciliation process. In 2021, the American Rescue Plan, which was the major COVID response bill, was enacted through the reconciliation process. And before that, the Bush and Trump tax cuts as well. So it is commonly used in recent decades. Reconciliation is a little separate as we think about the appropriations process. Looking at the fourth box on this slide, the beginning of the fiscal year, what happens if Congress doesn't come to agreement before the beginning of that fiscal year? So there are a couple ways that Congress can tackle things if they're not able to come to bipartisan agreement. A continuing resolution, which is sometimes called a CR in the news, is a spending law. So it's still enacted by Congress and signed by the president, but it basically says, well, spending should kind of continue at the same level that it did before, with a few exceptions. And it basically is used by Congress to buy additional time to negotiate. So Congress might say, well, we're almost in agreement, or we've agreed on certain things, but not other things. We need a little more time. We're not ready by September 30th. So we often see a continuing resolution pass for, say, 3 months. So instead of, it would continue funding through October, November, December, and maybe in December, they would say, well, by that time, we'll have agreement. So usually these are short term. It's sometimes we see multiple continuing resolutions. So maybe Congress enacts one until December, and they still haven't fully come to agreement. They're still negotiating some details. So they enact another continuing resolution that says, let's just continue until March, what we have been doing before. And then by then, we'll definitely have the full year bills figured out and those levels decided. And then we'll go to those agreed upon funding levels. So continuing resolutions are sort of a Band-Aid approach, and they're one approach if Congress can't come to agreement. Another thing that can happen is for the government to have a shutdown, either a full shutdown or a partial shutdown. And what that means is if Congress does not come to agreement on a spending law, including not coming to agreement on even enacting a continuing resolution, saying, well, we didn't come to agreement, so we'll just continue, then there can be a shutdown. And what that means is that discretionary programs who receive their money through the appropriations process just don't have any money for starting October 1st, and they may have to shut down. Mandatory programs receive their funding through authorization laws, so they often continue to operate pretty normally. Again, mandatory programs include Social Security, Medicare, Medicaid, and others. If a shutdown can be really long, they may be affected. But certain discretionary programs, including grants and services that receive funding through the appropriations process, can halt. And there may be situations where federal employees are required to work, but to not receive pay. So for example, you may have heard about, and I'll talk about this a little more later, you may have heard that the Transportation Security Administration staff are being asked to work, but are not being paid. So these are because there's a partial shutdown. So there may be situations where people are not paid until the funding for their agency is eventually approved. I've talked through the process. Now I want to step back a little bit and just go through these budget terms a little more clearly and give you a better sense of how this all fits together. We've talked about the appropriations process and how it funds discretionary programs. Again, we often think about those breaking down into defense-related programs and programs outside of the defense sphere. Mandatory programs, which are funded through authorization laws, are sometimes called entitlements. Again, Social Security, Medicare, Medicaid are three of the largest. And we also have interest on the federal debt as a major spending category. So just take a minute. I just want you to think for a moment. Which of these categories do you think is largest in among federal spending? And I don't think we have a chat, but I would ask you to put it in the chat but just think about it for a second. So we can see who was right, what your thinking was. So again, mandatory programs or entitlements make up about 60% of federal spending in fiscal year 2025. The annual appropriations process that we talked about, Congress setting laws, covers about 27% or about a quarter of total federal spending, that light blue slice. And then the orange slice is net interest on the federal debt, just about 15%. So this is just helping to shape kind of the distinction between mandatory programs and discretionary programs. Now I want to break it down a little more into more detail. So the blue pie slices here that you see are all mandatory programs. So again, Social Security, Medicare, Medicaid, the Children's Health Insurance Program, CHIP, and the Affordable Care Act, the ACA. You can see Social Security is a sizable chunk in and of itself, almost a quarter of the federal budget. Medicare, also a very large chunk. Again, those are all entitlement or mandatory programs. The orange pie slices that you see here are the discretionary programs that are funded through the annual appropriations process that we talked through. And again, about half and half defense and non-defense. You can see the orange slices, one's 13, one's 14%, about equal. And again, the gray slice you can see is net interest. So focusing specifically on that dark orange slice of non-defense discretionary, I want to break just that slice into more detail so you can understand outside of defense what is funded through the annual appropriations process. So kind of starting from the right and going around, non-defense discretionary, very technical term, but it includes economic security and social services, justice and the general government, veterans health, public health and medical research, education and job training, transportation, energy and agriculture, international affairs, science and space, environment and conservation. So when a lot of people think about what does the federal government do, often what they're thinking about is things that are funded through the non-defense discretionary annual appropriations process. So things like the Centers for Disease Control and Prevention, the CDC, things like the FBI, the Social Security, for example, the benefits are mandatory because the eligibility is set in law, but the Social Security Administration, the staff who actually administer the program, who run the program, they're funded through the annual appropriations process. The Environmental Protection Agency, NASA, all funded through this annual appropriations process. So just to give you a little more kind of flavor of what does this actually mean, a lot of things that people typically think about as what the federal government does is funded through this process. And just to kind of remind us, this is what we talked through earlier. That process kicks off with the president's budget and then really moves to Congress. And the bulk of the work happens in this third blue rectangle, the annual appropriations process, where those funding levels are determined before the start of the next fiscal year. So again, this is how it works in theory. I told you I would give you a little bit more flavor about what does this mean this year to help kind of tie some of these bigger concepts into what you might be hearing in the news, what's actually happening. So recall that I said there are 12 appropriation subcommittees. For fiscal year 2026, which is going to end this September 30th, Congress has enacted 11 of those 12 appropriations bills. So what this means is we are in a partial shutdown, but it's very partial, right? So 1 out of 12. So it's not like half the federal government is shut down. The one bill that has not been enacted or signed is the funding for the Department of Homeland Security. That doesn't mean that everything in the Department of Homeland Security is completely shut down. And that's because certain activities can receive funding through other means. Immigration and border activities received a lot of mandatory money in the bill that was enacted last summer. So they have a lot of money through a separate vehicle, and they're not solely funded through the appropriations process. So they're not affected by the current lack of appropriations funds for the Department of Homeland Security. But there are other aspects of the Department of Homeland Security that are not being funded right now. And one of the most visible ones that you may have heard about, or if you've traveled recently, been concerned about, is the TSA agents who run checkpoints run security at airports. They are being asked to work when their paychecks are not funded because this bill has not been signed, and won't be able to be paid unless there is some additional action taken or unless this bill is enacted. That's the fiscal year that will end September 30th. If we look ahead to the fiscal year that starts October 1st, the president's budget, or the plan for that upcoming year, is expected to be released around the end of March. So I said February in a calendar, it depends. It's a little delayed this year and it's not yet out. So the 2027 process hasn't even started. Those sort of 4 boxes were still before the first box, right? And then once that president's budget comes out, potentially later this month, then the congressional process will start. Then it'll move to Congress. They'll have to create their plan. They'll have to actually write the spending laws for the upcoming fiscal year. And it's an election year. There will be midterm elections in October. So it's a little unclear how Congress will get all of that work done before October 1st, knowing that they're also paying attention to the elections, knowing that the president's budget is later than it might be in another year. So it's possible that we would see a continuing resolution happen this year that would continue funding levels through the end of the year, for example, or continue it into the fiscal year rather than have all new spending bills enacted for fiscal year 2027. There's also some talk about a reconciliation bill being considered. So once the president's budget comes out, Congress could decide to make a plan to do this kind of fast-track legislative process. They would have to put that into their plan before they go about it. We don't know what's going to happen on that, but there's some thinking that could be a possibility. So that hopefully gives you a sense of the overall process, kind of what exactly is funded in that overall process, and how this all ties into what you might be hearing about in the news kind of throughout the year, right now, what to expect and how to think about this in the upcoming year. So I'm happy to take any questions. Thanks so much.
Thank you, Chris. We appreciate you presenting today. This has been extremely helpful in clarifying not just the structure, but the real world implications. My name is Jennifer Bertrand, and I'm the chair of the NACDD's Public Policy Committee. Before we go on to questions, I want to introduce Erin Prangley, Policy Director, and have her spend a few minutes talking about how our network uses this framework to advocate all year. Erin?
Thank you, Jennifer. My name is Erin Prangley. I am the Public Policy Director for the NACDD, and I'd like to briefly translate what we've just heard into our advocacy calendar that DD councils and other organizations that have programs funded through the appropriations process live every year. Many people think that the budget is just a number. It's just a line item that somebody else decides. But the truth is, the federal budget is a cycle, not a single event. And at every stage of that cycle, there's a chance to have real impact. It's important to remember that the budget defines our national priorities and values. It puts our policy into action. You see, the framers of the Constitution were very careful. They designed the process that the people, through their elected representatives, can influence how taxpayer dollars are spent and how programs like those supporting people with disabilities are funded. Understanding the cycle is the first step to making your voice heard. So I'll repeat a little bit about what Chris mentioned and put a little context and work plan into it. So let's start at the beginning. As Chris mentioned, the president's budget release is supposed to be in February. But in reality, the president's budget is a lot like a teenager. It's never on time. I'll go one step further and say, much like my teenager, the president's budget is aspirational. It's based on a 10-year plan. My teenager would like a Toyota Tacoma silver truck this year and $50,000 for it. I, however, am looking at a budget which does not support that aspiration, and therefore I will probably be able to allocate much fewer funds, maybe enough for a Toyota Corolla. So that's the system of checks and balances in my family. And it's similar to the checks and balances that the framers put out for Congress and the administration, so that your representative in Congress has power to push back against the president when he releases his budget. That's not to say that the president budget isn't important and shouldn't be paid attention to. This is the administration's plan for federal funding. It signals priorities for the coming year. But here's something to remember. As Chris mentioned, the president's budget is not law. In fact, it rarely passes exactly as it's submitted. And this is your first really big opportunity to engage. In fact, the president's budget in the past tried to eliminate the DD councils. But due to incredible advocacy and our congressional champions, DD councils were level funded. Again, just last year, the president's budget tried to eliminate our university centers on excellence in disability. But again, advocates through their congressional champions were able to secure funding through the appropriations process. And we won because advocates like you paid attention to the president's budget, spoke up early and often. We let our members of Congress know that the president was wrong, that there are critical programs, and it's fierce advocates like you that make sure that the president's budget items are brought to our representatives and scrutinized or looked at carefully to see how it will affect people with disabilities. Also, consider this year's election cycle. This can affect what gets proposed. Don't be afraid to push back by asking candidates and incumbents to support full funding for all of our disability programs. Early advocacy helps set the stage for the conversations that will follow. So getting candidates on the record is fierce advocacy. And for those of us advocating for people with disabilities, this right now is the moment to highlight programs that directly impact real lives. Next is the appropriation season. It's usually March, late spring, early summer. And this is when NACDD really gets to work. Congress starts drafting its own spending bills. And here's a tip for advocates. Find out who your members of Congress are. And know, are they on the Appropriations Committee? These Appropriations Committee members are extremely powerful because they are the ones that actually write the bills. However, all members of Congress have the opportunity to support requests through sign-on letters and voting. Maintaining a relationship with your member of Congress is critical. Every year we recognize Developmental Disabilities Awareness Month in March. That's great timing for our work with the federal funding process. It's a great point in the cycle to contact your congressional office. We usually know what the president's budget is put out there, and we have a talking point to say we support the budget or we disagree with the budget. So now is the time to educate them about priorities in the disability community. How do you do that? Invite them to your events. Show them firsthand how federal funding impacts your community. And when they do good work, like supporting DD Council programs, recognize it. Send them a thank you note or a shout out at an event or a public acknowledgement. This will go a long way in strengthening support. I like to tell people I'm training that there are two people that members of Congress will talk to every day, and neither one of them is their spouse. It's their chief of staff and their communications director. And the communications director is the one that checks all of the social media. So if you like social media, use it. Use it as a way to build that relationship with your member of Congress. As we move into summer and fall, the budget goes through committee markups, floor action, and negotiations. Bills are debated and amended, and this is where technical knowledge matters. So if you know that your member is on a relevant committee or a subcommittee, they can make or break funding proposals. At NACDD, it's my job to monitor hearings, submit letters, or provide testimony for the entire network. But I have to work with advocates and you and executive directors to make sure that members of Congress have that practical real world stories so they can make informed decisions. This stage may feel very technical, but making sure our elected officials are informed ensures that the funding decisions reflect the actual needs of people, not just a number on a spreadsheet. Finally, we talked a little bit about continuing resolutions and shutdowns. These are scary times, and continuing resolutions and shutdowns are thrown around like, this is normal. It's not normal. Congress has one job: collect our taxes and make sure our money is spent in a way that reflects our priorities as Americans. They've really not been doing that job very well on time. They're like the person who's the student constantly turning their term paper in late. It's not acceptable. It makes it difficult for state DD councils to plan budgets and to pay their staff. These in certain times are very difficult to manage, and it's okay to push back against that. Another problem with continuing resolutions is we may have had some very serious conversation in committees and had a bunch of bills passed. All of those go out the window because the continuing resolution just follows what we did the year before. So we don't like continuing resolutions, and neither should advocates. And you should push back against your members of Congress for not getting their jobs done on time and demand that there be federal funding on time for DD councils and other programs that are important to people with disabilities. Finally, shutdown threats. These moments are extremely stressful, especially for communities relying on critical service. This is the time to pull out your story bank, to start telling members of Congress and NACDD, this is how a shutdown affects me. I myself am laid off, or I'm not receiving a paycheck, or I don't know whether I can continue to support my staff who, if I don't know how much money I'm going to get, my state may not allow me to keep my staff on board during a shutdown. We need to hear those stories. After bills are enacted, too, there's something that was not included in Chris's slides, but I want to mention that this is a very important time to make sure that even when Congress says, here's how much money your program's going to get, that you actually get the money. The administration is responsible for spending the way that Congress tells them to spend it. But oversight and relationship building is important because we have seen some withholding of funding and some repeal and withdrawal or clawback of funding in recent years. So staying on top, and we do, with your agencies, maintaining a good relationship with your members of Congress and making sure that your funds are given to you or dispersed in a responsible manner is just very, very important. Continue to use plain language, connect real life to real impact, know who makes these decisions, educate them, invite them to your programs. Listen, the budget is about choices and priorities. And we are a part of that process. It was designed so that your voice through your representatives can shape those choices. But effective advocacy requires anticipation. You need to know the next step. Understanding these mechanics allows us to engage proactively rather than reactively. That's how we win. Understand the cycle, engage strategically, and we will ensure federal funding reflects our values to support the needs of people with disabilities and the communities that we live in. I'll now turn it back over to our policy chair, Jennifer Bertrand, to share how NACDD supports our councils throughout the process. Thank you.
Thank you, Erin. NACDD works year-round to ensure councils have NACDD works year-round to ensure councils have the tools, information, and coordinated strategy necessary to engage effectively. Each month, NACDD staff present federal budget developments during our public policy committee meetings, which are held on the first Thursday of each month. Staff help to coordinate national messaging, provide appropriations guidance, train executive directors and advocates on outreach calls, educate members, supporting a rapid response during continuing resolutions or shutdown scenarios. We also work to strengthen relationships with key congressional offices. In volatile fiscal environments, coordination and clarity are critical. Our goal is to ensure councils are informed, aligned, and prepared. We now have a few minutes for questions. Please submit them through the chat, or actually the Q&A, I believe, is what we're using. Or if you need an accommodation, you can raise your hand. I know there were a couple of questions in the chat earlier. The materials and recordings will be uploaded to the portable for members. Checking out the Q&A. I don't see any questions in there yet. I did notice in the chat, Dorothy Clark, you asked, how do we get them to come to our organizations? I think you might have met. Erin or Chris, do you want to take that one?
Oh,
Yes,
Dorothy.
Organization.
Dorothy, this is Erin Prangley, and I would love to take that question. And I encourage you to join any of my public policy office hours, which are every other Friday, and we can talk more. But you invite them. Members of Congress, especially in election years, are looking for ways to interact with people. If
Been
you
trying
have
to get them to come here,
Okay.
and they give excuses.
If you have a group of people, there are some tips I can give you. Number one, there's strength in numbers. So if you get a group of people together, it's usually a little bit easier to get them there. So organizing a town hall, for example, would be easier to get a member of Congress to than to other types of events. The DD councils are particularly well placed for this because you have regular DD council meetings. And these meetings have members of the state state agencies there with you. You can work to get those agencies to help you get that member of Congress there, to listen to them, to hear the concerns of the states, work in coalition with other groups. I do an entire presentation at our Partners in Policymaking about how we do power mapping. If you don't know the congressman, then you probably know someone who knows the congressman. And finally, in an election year, I'm going to say something a little controversial. As a council member or an advocate acting on your own behalf, do not shy away from campaign events. Find out when the member of Congress, if it's an incumbent, is having a campaign event or riding in a parade or going to a town hall. Call their office and say, listen, I don't have the money to attend this campaign event, but I'd really like to participate. You'd be surprised. When I worked on campaigns, we had two goals. Number one, to make money. So all of our events, we would charge a fee. But number two, to fill the room. And in many of these events, if you call and explain, I don't have $250 for this event, but I've got $25, can I come to the event? You'd be surprised. Many members of Congress need to fill those rooms and you can go. And as an individual, campaign events are a wonderful place to get the ear of the congressman. So please tune in. Again, I think working with your DD council, inviting them to regular council meetings is helpful, and finding out power mapping who has relationships with your members of Congress. It may be a state legislature that you work with. It may be the congressman's spouse. I've seen all sorts of ways that organizations have thought creatively to get the ear of the member of Congress to their event.
Excellent advice, Erin. Looks like we
Thank
have
you.
a question from Kevin Nunez. Kevin, why don't you go ahead and ask your question?
I'm sure. Thank you very much for your time. I just wanted to say, when you meet with legislators, be extra grateful because programs that we take for granted, such as the Center for Excellence or even the council, when you reach out initially, they don't know what we are. It's so funny for us. It's all second nature, but the fact is, unless they're affected by disability personally, they have no idea what disability services are. So when you meet with them, don't be shocked if they don't even know if they don't even know what long-term services and support are. Um, One time I met with the legislator, and I literally had to walk them through what HCBS was. So be extra grateful, have extra talking points. Be prepared for everything.
This is Erin Prangley from NACD again. I'd like to thank Kevin for that point. I'd also add that members of Congress staff turn over frequently. So that's why I say March, Developmental Disabilities Awareness Month, is always that month on the calendar that should remind all of you, gee, have I talked to my member of Congress this year? It's a terrific way to get their attention, to go in and to speak with them at that point, especially new members of Congress. I would also add to Kevin's point, don't forget who you are. If you care about DD councils and USEDS, remind your members of Congress that you are federally funded. A lot of us work in state houses. So, we're going to work and everybody's going to work on state issues. And then we're going to go and we're going to work to save Medicaid. And then we're going to go work and we're going to work to save HCBS. But we forget that every single year we're on the line too. So when you introduce yourself on behalf of the council, remember to slip in there that we are federally funded, governor appointed groups of advocates. And so that will remind these members of Congress that if you're doing good work, it's because of the appropriations that you receive every year from the Congress.
Jennifer Bertrand here again. Looks like we have another question in the chat this time from Darcy Robb. And it's to you, Erin. Do you recommend going to campaign events for Congress people whose actions do not reflect council values?
Yeah, absolutely. That's a better event to go to. Why would I pay $25 to go, talk to someone who already votes my way? This is my personal opinion as a lobbyist. My personal opinion, we should support the people who care for us. Absolutely. But we should also be working to impact and influence people who maybe just don't know us. Disability is not a partisan issue. I believe that strongly. It was something that Justin Dart used to talk about before they passed the Americans with Disabilities Act, which was signed by Ronald Reagan. This is not a partisan issue. Almost everyone we know has been affected by disability, whether they have a disability themselves or if they know someone with a disability. It's our job to put our lived experience into policy and provide them the opportunity to grow and understand that these programs are critical and they are part of our family values. They're part of our American values, and they have no party. So yeah, sure, go to campaign events. For those of you who say, why should we support this party over this party? I'm not being political. This is a conversation about advocacy, and I, by all means, follow all federal and state laws regarding not lobbying or participating in any political campaigns on behalf of your state DD council. But as individuals, you're building a relationship with people, and you can do that in many ways. And one of those ways is through campaign events.
Erin, could I ask a follow-up to that? Because this is a really interesting conversation that's helpful to me and hopefully other folks. I actually wasn't coming at it from a party perspective, but I'm thinking there's a particular state legislator in our state who's running for governor. There have been multiple advocates who have very clearly spelled out the benefits of waivers and HCBS to this individual. Um, he's claiming to not get it, and he actually asked our council chair how she'd feel about reopening institutions. So I guess I'm just, frankly, I don't want to give a person like that any more money because it feels like we've made the case and this person is just gone. So I don't know. Is there any kind of a nuance or a line in the sand beyond which you're like, okay, we don't need to be there?
So I love that question, which is great for our policy hours, because what I would do is power map that with you. So sometimes it's not the message, it's the messenger. And I come from the women's movement, and there's a very famous story about the vote on the 19th Amendment in Congress, which was a step to getting women the right to vote. And it was a very close vote. And one of the defining votes was influenced because the mother of the congressman put a note in the congressman's pocket that said, "Remember the women." So, yeah, it's called power mapping and lines of influence. And if this particular person is not listening to you, consider other people in your network that they may listen to. We have terrific Republican advocates in our state legislatures, for example. We have terrific former members of Congress, such as Kathy McMorris Rogers, who are incredible spokespeople and who are trusted messengers to people who don't normally connect with us. So the lines of influence may not be you. Your story might not be the story that connects, but it is your job as an advocate to consider whose story would connect with that person. And be creative, sit in a room with colleagues, have fun with it, get together for a cocktail hour with your council and just start talking about who goes to church with this person. I remember my daughter played basketball, and I'm not going to say, my daughter played basketball with a girl whose father is on the Supreme Court. And I'm not going to say which one, but it's strange coincidences like that. It's a small world. And I find more and more often that if we get out of that partisan construct, if we get out of that, they're never going to listen to me, this is a waste of my time thing, and start thinking more creatively about, well, who would they listen to? I think we'll be in a better place.
Sound advice. Jennifer Bertrand here, Erin. I've got one eye on the time. It's 4:58, so we would have time for one very quick question. Let me see if there are any more. A lot of thumbs up here in the chat for your responses and your guidance, Erin. Some folks sharing that they found this presentation today very valuable. I don't see any other questions. Given time, I want to thank our colleagues at the Center on Budget and Policy Priorities for their clarity and expertise. And thank you to everyone who joined us today. We will share the recording and the materials following the webinar in the portal to NACDD members. And we encourage you to continue engaging year-round. Informed advocacy makes a difference. Have a wonderful afternoon.
Saving transcript and closing us out.